Yeah, it's from. What they do, you want me to close that door or leave it open? You tell me if it's. Okay. Okay, yeah. All right, y'all. Hello and happy October. It's Breast Cancer Awareness Month, as y'all know, and so today we are starting our first Wellness Wednesday session for the month with Ms. Whitney McCartt, who is no stranger, and she has been here several times, and we partner with Helen Keller to always have them during October for breast cancer awareness. She uses the latest and all the guidelines and prevention. So I'll let her introduce herself, or you maybe new or not know her. She's got a great session for us today that's a little bit different from what we've done in the past. I'll let her go over all that.
Yeah, so for those of you who don't know me, I'm Whitney McCartt, and I am a breast nurse navigator for Keller Breast Center at Helen Keller Hospital. I'm a registered nurse. I've been doing this for a little over 5 years. So if you're not familiar with what a navigator is, I do everything from following patients with abdominal breast imaging all the way to meeting with newly diagnosed breast cancer patients and helping to navigate them through their diagnosis. So once they're diagnosed, we do have a one-on-one meeting and we sit down and talk about, those questions that maybe they didn't have time to think about and ask in that appointment with their doctor. And then from that point on, I can assume the role of financial counselor, social worker, all those different hats, finding transportation. We help pay bills. We do several fundraisers throughout the year to help. We have a patient assistance fund where we'll help pay bills for patients while they're going through treatment. And another thing I do is community education. So the month of October is very busy. I'm usually somewhere every day of the week, along with being in the office, meeting with people. So I enjoy this part because I do feel like educating the community about screening and, their risk of breast cancer and what you can do preventively does help lower your risk and hopefully keeps you from being in my clinic at some point. So today we're going to talk about breast cancer and we're going to talk about risk. We're going to talk about guidelines. We're going to talk about screening recommendations, breast self-exam. And I've got some different treatment scenarios and things like that. So before I go on here, let's do the Smith Buster right quick. All right. So those that are online don't have this, so I'll just read them. Most breast cancer runs in families. Guys, good answer. Men.
What do y'all think?
The men. So while breast cancer can be familial, meaning, you have a family history, about 80% of breast cancer is not genetic or family related. I have more breast cancer patients come in my office that have no family history than those that do. The radiation from a mammogram can cause breast cancer. If in fact, yes, it is a very low radiation dose that you get at your mammogram, and that's yearly. In order to receive the best care, you must travel to a larger institute. Men, yes, I must say men. I will be telling you all about my program and everything as we go through this and what we do. And we are doing things that are comparative to those larger institutes right here in a small town. Most breast cancer comes in the form of a lump. Yeah. And I'll go through and kind of tell you guys some of the things to be looking for breast cancer. It is worse to go through chemo and surgery than to leave breast cancer alone. Yeah, absolutely. All right, so what is breast cancer? So breast cancer starts when our cells start acting a little bit wonky. So when we're born, our cells, they have a job to do. They have a mission. They know what they're supposed to be doing in the breast. And then at some point, they mutate. They decide to start replicating out of control, and they grow abnormally. And that's when those tumors start to form. They go through a normal cell cycle. They grow, divide, make copies of themselves, and the signals, when they get damaged, they die off. Well, with a cancer cell, sometimes that doesn't happen, and they start to grow and grow and grow. It's not always a mistake in the genetic material. 5 to 10% of cancers are linked to genetic abnormalities inherited from a parent. About 85% of breast cancers are caused by genetic abnormalities that are a result of getting older and the wear and tear of life insurance. So that's what I was saying about how it can be familial, but most of the time it's not even a genetic predisposition for you to get breast cancer. Most of the time it's just you're getting older, your cells start doing the wrong things, and therefore you start to develop these tumors and replications of these cancer cells. All right. There's many different types of breast cancers. One of the things I tell breast cancer patients when they come in is when you're diagnosed, it's very easy for family and friends to start coming out of the woodwork and telling you, well, this is what I did, and this is what my friend did, and you don't need to do that, and you need to go here. And I just like to present that this is your puzzle, and as we go through gathering this information, those are your puzzle pieces, and those puzzle pieces are going to develop your treatment plan. And Susie's treatment plan had different puzzle pieces than your treatment plan. So when I say there's many different types of breast cancer, there's all different types of puzzle pieces. Like it could be in the duct of the breast, it could be in the lobules of the breast, it could be hormone positive, it could be hormone negative. The size of it could be different. It could be, what else? The HER2 could be positive or negative. There's just so many different things that are taken into consideration when developing your treatment plan for breast cancer. And unfortunately, the cause of breast cancers is unknown at this time. But there are many things that, we're learning about that we think contribute to that. So like I was saying, I just like to put this up here because a lot of times, we don't really know, we see the outside of the breast, but looking from the side angle of the breast, like I was saying, the different types, you have lobules here in the breast. So you can have lobular carcinoma, and then you can have ductal carcinoma, which are these little tubes here. So breast milk are in these sacs right here. So that's where it's stored and made. Ducts are what takes it out to the nipple here. Next. All right, breast cancer. How common is it? It is the most common cancer in women in the U.S. aside from skin cancer. It's the second leading cause of cancer-related death in women in the U.S. Does anybody know what the first leading cause of cancer is? Cancer. About 1 in 8 women in the U.S. will develop invasive breast cancer during their lifetime. So if you look around the room, there's several of you in here, but 1 in 8. So just out of this little section right here, that's a 1 in 8. So it's a staggering odd if you think about it. These were just some statistics at a glance for 2024. Estimated new cases for 2024 of breast cancer cases was 310,720. The percent of all new cancer cases that they accounted for 15.5%. And this is just an estimate. The estimated deaths in 2024, 42,250. And it's 6.9% of all the cancer deaths of 2024. 5-year survival rate between 2014 to 2020 is 91.2%. pretty good. We'll go to the next one. So I pulled this just to point out, so this huge area right here, 63%, this is localized breast cancer, so confined to the primary site. So that means that when the breast cancer was found, it was localized to just that area. Okay, so that's 63%. 28% was regional, meaning it had spread to just the local lymph nodes, like just in the armpit. Distance was 6%, meaning it had metastasized to other parts of the body. And then 3% was unstaged, which meant it was unknown. 63% localized. So I like to point that out because it says the 5-year relative survival for localized female breast cancer is 99.6%. So what that means is the earlier you find it, the higher your survival rate is. Okay. So if it's localized, that means you've caught it early. It's still contained in that one area of the breast. It has not spread. So, which also leads me to say those screenings that we do, those preventative measures that we do are so important because they catch those things at an earlier stage. Okay. Okay, breast cancer risk factors. The two main risk factors for breast cancer, gender and growing older. So 2 things that we can't change, being a woman and getting older. All right. Genetic risk factors, just like we talked about. So, you can have the BRCA1 or the BRCA2 genetic gene. Oh, what's the word on here? And if you do, that increases your risk by like 70 to 80% of developing a breast or an ovarian cancer. And that's something that you can take a test online. Usually there's different genetic companies that do the genetic testing that will give you the test online, and it'll tell you if you qualify for your insurance to pay for that test. And then if you do, you have the option to go ahead and do preventative surgeries like a mastectomy or hysterectomy. Some choose to do that. Some choose to just do more testing. They might do breast MRIs. They might do, more frequent mammograms, things like that. Family history of breast cancer. So this is the familial breast cancer that I was talking about. So yes, if you do have a family history, yes, your likelihood of developing one is higher. For instance, I have a strong family history on both sides. I have breast cancer on my dad's side. I have prostate and ovarian on my mom's side. So I am more cautious with my health in that way because obviously there's something in my genetic material that makes my cells more likely to turn against me. Okay. Personal history of breast cancer makes you 3 to 4 times more likely to develop a new cancer in the other breast or a different area of the same breast. So if you had a partial mastectomy or a lumpectomy, the likelihood that you could develop a cancer in the same breast, just in a different area, is higher. Or if you had a mastectomy on the cancer side, are more likely to develop a cancer on the opposite unaffected side. Previous chest radiation. So this would be for someone, a lot of times if you had a previous cancer that required a chest radiation, if you had a childhood cancer like a lymphoma, where you had to have radiation. A long time ago, they used to do like facial radiation for acne treatments and things like that. Those would put you at a higher risk. Post-menopausal hormone therapy, same with recent use of hormonal contraceptives. So both of those are putting extra hormones back into your body. So like I was saying with breast cancers being hormone positive. So when you have a breast cancer that's hormone positive, it has receptors on the outside of it that are literally being fed by your hormones. So it's got estrogen receptors, progesterone receptors. And if you're taking hormone therapy because you've went through menopause, you're just adding that to that cancer and making it grow. Same with hormonal contraceptives. I know that you're typically younger when you're doing that. But if you're at the age where you should be thinking about being at risk for a breast cancer, then that's something you should take into consideration as far as screenings, breast self exams while you're taking those. Race, I did pass out the Black women statistics just because there's some new information on that. And I really tried to push that this time around because I went around and spoke to a lot of people this time, especially at the high schools. For younger Black women especially, before age 40, younger Black women are being diagnosed with breast cancer, and it's usually more aggressive. At age 25, Black women can be assessed for a high risk. They can do a high risk assessment for breast cancer to see if they are more likely to develop a breast cancer, so that hopefully they can start a better screening program. You know, get on some kind of routine with their physician where they're being checked frequently, and more aware of their risk, you know, themselves. Obesity. There's an article that I passed out about obesity, because there's some new studies on that as well. All right, so obesity particularly because fat cells generate estrogen. So the more fat cells you have, the more estrogen in your body. So if you have an estrogen receptive tumor, then that's feeding the tumor, okay? If I'm the study, okay, a 2024 study found that women considered to have obesity, a BMI of 30 or higher, are more likely to be diagnosed with estrogen receptor positive, progesterone receptor positive breast cancer. And women considered to have severe obesity, a BMI of 35 or higher, were more likely to die from breast cancer than women with lower BMIs. That was significant. Then there was one about metabolic syndrome. Maybe that was just on that, but I gave you guys.
Okay. Did you need this one?
All right. The metabolic syndrome may increase a woman's risk of death from breast cancer after menopause. Metabolic syndrome means you have at least three of the following conditions: extra fat around your waist, high blood pressure, high blood sugar, high triglycerides, or low HDL cholesterol. I just thought that was interesting because just our population today in America, I was just listening to a podcast about how terrible our food is compared to Europe and everywhere else, and all the additives and all the things, and how literally 50% of our population has diabetes. It used to be 2%, and now it's 50%. That's a significant increase. And how every year 13% increase in autoimmune disorders. It's just like, it was just crazy, just the things that they were saying. And so, I mean, you can't tell me that it's not contributing to our breast cancer too, because the amount of breast cancer I see in this area is just, but I can't prove that, but I know that the way we eat and the things that we eat, the obesity, you know, but I know fat cells make extra estrogen. And I know if you have an estrogen positive breast cancer, that is contributing to it. So how do we combat that? You know, we have a healthy diet, we exercise, alcohol, research consistently shows that drinking alcoholic beverages, beer, wine, and liquor increases a woman's risk of hormone receptor positive breast cancer. Alcohol can increase levels of estrogen and other hormones associated with hormone receptor positive breast cancer. Alcohol also may increase a breast cancer risk by damaging DNA cells. Compared to women who don't drink at all, women who have 3 alcoholic drinks per week have a 15% higher risk of breast cancer. Experts estimate that the risk of breast cancer goes up another 10% each additional drink women regularly have each day. So, not only that, but alcohol suppresses your immune system. And our immune system is our first line of defense against all things. There's no telling how many carcinogenic things that we come in contact with every day that our immune system fights off. So if our immune system is not at its peak performance, those things can't be fought off as well. Not having children or having them later in life. So that has to do with the amount of estrogen circulating in your body or your hormones circulating. So if you start your period early and then you have menopause later in life, that's just an extended period of time that you have those female hormones in your body. Breastfeeding. So breastfeeding is good, and I know not everybody can do it. So I don't harp on that a whole lot because it's not for everybody. But one thing that it does is when you're an adolescent, your breast cells are mature. And so when you have a child and you breastfeed, it causes your breast cells to mature. Okay. And at that point, they have a job to do. So what their job is making breast milk. So when they have a job, they're less likely to stray from that job and do something else like mutating, becoming a cancer cell, that kind of thing. Okay. So that's why breastfeeding is pushed, why it's promoted. It's also with having children earlier, not after 30. So when you're pregnant, that's 9 months of not having a period. So, that's decreases in those hormones. Also, same with the breastfeeding, it changes the hormones in your body. But like I said, I don't push those as hard because that's not something that a lot of people have control over. So we talked about the alcohol, the hormone therapy, as far as dealing with symptoms of menopause. Because so many women have hormone positive breast cancer, the good thing is they've come up with a lot of different medications now that are not hormone driven that these women can take to help combat these side effects that their drugs have. Because once you have a hormone positive breast cancer, they're going to give you a drug that essentially is going to send you into menopause. Okay. So they have all those symptoms. They have the hot flashes, they have the vaginal dryness, all those, the skin issues. So they now have some drugs that they can take. They can do vitamin E, lots of different things. Having children before 30, breastfeeding, just things to consider. All right. Are there any questions so far? I feel like I'm just speaking through this.
I do. What about IUDs? Like,
Okay, so IUDs they do give out hormones.
okay.
So, my encouragement is if you're gonna do any kind of hormonal contraceptives, you just need to, if you're at the age where you're due for any kind of screening, stay on top of that.
Right.
I do know of physicians that, will do hormone pellets without a mammogram first. They'll just have you sign a waiver saying you're aware of your risk. I'm not for that. Okay? I don't care if you do sign a waiver. Just don't do it, because once it's in your body, you can't get it back out. All right, so yeah, birth control, IUDs, Implanon, any of those things that are used for birth control methods. Okay, so something isn't right. Is it cancer? Breast cancer symptoms vary widely and many have no obvious signs at all. So most commonly is a lump or a mass. Okay, even though on our myth, that's what we said, but most commonly people are gonna come in and say, I feel something, something doesn't feel right. There's something hard. But when you feel it in the breast, it's usually painless, it's hard, it's uneven, and it doesn't move. Uncommonly, it's painful. It can have pain, but usually if it's painful, it's because it's pushing on like surrounding tissue or pulling on surrounding tissue. You can have pain in the nipple. There's a type of breast cancer called Paget's disease, which is like inflammation of the nipple. It can be red and scaly and itchy. But the reason I don't like talking so much about this is because I've seen so many times where they can have one symptom like this or none or all or some. I can remember one of my very first breast cancer patients when I worked plastic surgery. She was, I think, 29. And she had like a painful, like, place in her breast that people, like her doctors just blew it off as a cyst for several months, and it ended up being breast cancer. But I mean, she was 29 and it hurt and it moved. And I mean, why wouldn't it have been a cyst, because based on what we know. So that's why anytime you have a lump or anytime something's not the same with your breast, something has changed, the only way you can truly know is by getting some imaging done, okay? An ultrasound, a mammogram, seeing your doctor. Sometimes a biopsy is needed to know for sure. But, these are just the typical things that, are said about cancer versus benign, masses in the breast. Things to look for, swelling in the breast. It can be just one area. It can be the whole breast. One breast can be twice the size as the other. You can have skin irritation or dimpling, pain. Like I said, not normally do you have pain, but sometimes you can have pain. I've had patients have pain, that shoots into their back, into their arm. Nipple pain, inversion, so the nipple is going in. Redness, scaliness, thickening skin or nipple. Nothing else but just a rash on the breast. Nipple discharge, should never have discharge from the nipple unless you're breastfeeding. And it can be green, it can be yellow, it can be clear, it can be milky, it can be bloody, a lump in the breast, the axilla, or the clavicle. So the lump can be in the breast, behind the nipple, it can be in the underarm, and it can be all the way up here in the collarbone area. The thing about it is it can also be signs of less serious conditions like an infection or a cyst. Okay. So, you can have mastitis. If you breastfed, you're probably familiar with mastitis. You get a clogged milk duct, your breast swells up, it's red, it hurts. There's a such thing as an intraductal papilloma, which is just, if you're familiar with a colon polyp, it's basically the same thing. But it's in the duct of the breast. It's just a little finger-like projection inside the breast. Most of the time you have them removed because they can turn into a cancer. But they can cause a discharge out of the breast. Some people have nipple inversion for no reason at all. They will just have it. Skin irritation, poison oak, who knows? I mean, why you got poison oak on your boob, I don't know, but I'm just saying. Things happen, right? But this is why monthly breast self-exam is the best way of noticing any changes. Okay, slide. This is just a animated version, but texture changes, dimpling, so it's kind of concave, discharge, redness, lumps in the armpit, which are likely going to be lymph nodes, nipple inversion, and then lump. So outward projection, inward. Advantages of breast self-exam. Women can use them to assess their breasts, and when they perform it properly and regularly, they will notice changes in their breasts and seek further evaluation. It should be done every month at the end of menses. So same time every month after your period. And the reason being is because after your period, your breasts are less swollen, less tender. You're more likely to, be able to feel changes. And if you're doing it at the same time every month, if something is different from last month, then you're gonna notice that, okay? So that's an actual video of
Okay.
somebody doing a breast exam. How much time do we have?
It's 12:35. We're still okay.
We're still good?
Mm-hmm.
Okay,
Mm.
all right, I'm showing it. It's like 5
Okay.
minutes long. Playing on the computer and the screen.
Upside down. Another minute.
Is it playing?
Yeah.
Okay.
Let me get it back up. Just put it back here so we can. Okay. Okay.
So per the American Cancer Society, research has not shown a clear benefit of regular physical breast exams done by either a health professional or by women themselves. There's very little evidence that these tests help find breast cancer early when women also get screening mammograms. Most often when breast cancer is detected because of symptoms such as a lump in the breast, a woman discovers the symptoms during usual activities such as bathing or dressing. Women should be familiar with how their breasts normally look and feel and should report any changes to a healthcare provider right away. I wrote like contradictory down here because obviously if you're familiar with your breasts, you're checking them yourselves, right? So why not do it once a month? So The American Cancer Society says there's no benefit to it, right? Jackie asked me to tell you what the guidelines are. What are the recommendations? Okay, so I'm not gonna lie to you, but I'm gonna tell you that I believe, in my opinion, there is a benefit to it. Now, do I believe that everybody has time to lay down like this and do it? I gave you guys a shower card, okay? It's got little punch outs on it for the month. Do it in the shower, okay? Do it in the shower. You've got it right in front of you. It's got a little hanger on it. Hang it up there where the water spigot thing is. All right? There's a really in-depth way to do a breast self-exam. And if your risk is really high, I would recommend doing it, okay? And I'm gonna send it to you.
Okay.
I forgot.
You got
It's
a
called
video?
the care, the
Okay.
way we did it.
Okay.
And, 3 fingers, like she said, but it's gonna be a dime size, circle that you're gonna do. You're gonna do 3 levels of pressure. You're gonna go light, medium, and then deep. And you're gonna do that over the whole breast, circular motion, even behind the nipple. And you're gonna put a hand on your forehead, not behind your head, and you're gonna have your knees turned to like a 45-degree angle if you do it, okay? But that's the true way to do it. And then after you do it that way, on the side, once you get to the middle of the nipple, then you lay on your back. What that does is it displaces the breast tissue this way, so it's easier to feel. And then when you come back this way, your breast is naturally gonna fall this way, so you can come inside of the breast, okay? But I'll send
Yeah,
that to you.
that's
Um,
great.
Because for people who are high risk, I mean, you're gonna be more diligent about checking your breast anyways. And knowing the proper way to do it is significant. All right, you go.
All right.
For screening purposes, a woman is considered to be average risk if she doesn't have a personal history of breast cancer, a strong family history of breast cancer, or genetic mutation known to increase her risk of breast cancer. So this is for a woman of average risk. This is from the American Cancer Society. Women between 40 and 44 have the option to start screening with a mammogram every year. Please start your mammograms anyway. Okay. Women 45 to 54 should get mammograms every year. Women 55 and older can switch to a mammogram every other year. Please keep getting your mammograms every year at 55. This is just the guidelines, okay? Screening should continue as long as a woman is in good health and is expected to live at least 10 more years. So there's a lot out there. I have women ask me all the time or tell me, I'm 75, I don't have to get mammograms anymore. And they literally are still driving to Big Below shop, you know, every weekend or whatever. You know, they play bingo at the senior center. Whatever it is, you know, and I'm like, yes, please go get your mammogram because you're obviously gonna live till you're 95. So, yes, and your insurance should pay for it.
It does.
You can actually get a baseline mammogram starting at age 35, from 35 and 40, 1 mammogram. And that's a mammogram to compare starting at age 40, okay? So I had a baseline at 35, so that when I turn 40, I'll have something to compare it to. Screening recommendations for women at high risk. So women at high risk, I actually wrote down the website. I'll tell you guys in just a second. So this is women who have a lifetime risk of cancer of 20 to 25%. Right? Should get a breast MRI or and a mammogram every year, typically starting at age 30. And this is, so if you guys want to write this down, BC risk tool .cancer.gov. BC, like breast cancer, risk tool .cancer.gov. And that's just a free breast cancer risk assessment that you can go and take. It takes 5 minutes. The only thing that it doesn't ask you is if you have a history of breast cancer yourself. Okay, so it does not take that into consideration. But if that is the case, then you can present that to your physician. They can submit that to your insurance and hopefully get you on a plan where you're doing a mammogram and an MRI and you're alternating those every 6 months, which is what you should be doing, okay? And this is just telling you, these are the things that are making you at high risk. You know, you've got a gene mutation, which I told you guys, you know, if you have a gene mutation, that increases your risk by 70 to 80%. First degree relative that has a gene mutation, the radiation therapy, and then there's several syndromes down here, that would increase your risk, and you would know if you have those. And then these are some pictures here that I wanted to add. So, lump in the breast, you guys see that? Inverted nipple. This is a French term. I'm not going to pretend to know how to say it, but this is where the skin looks like an orange peel. So this is thickening of the skin, and you can actually see that on a mammogram. They'll actually dictate that in the report, say, you know, thickening of the skin, and then of course nipple discharge.
I do have a question online.
Okay.
Should people with dense tissue begin screenings earlier than the recommended age, regardless of family history?
So, there are some additional tests that you can do for dense breast. MRIs are really good for that. Unfortunately, there's not any like recommendations for that, where insurance will pay for that. But sometimes your physician can, go to bat for you on that and say, you know, once you've had your mammogram done and it does say that you have very dense breast tissue, they can submit that along with, a dense breast survey and get you an ultrasound and go from there and hopefully do what we have an MBI, it's molecular breast imaging. We're the only ones that have that here. And that's a really good screening for dense breast tissue as well as MRI.
Is that new?
No, we've had
Okay.
it for a long time.
Okay. There's another question. Do men have the same symptoms?
So with men not having as much breast tissue, their symptoms are gonna be a lot more obvious. It's definitely gonna be a lump. The mass, you know, is gonna be, their sign or symptom. Men don't get mammograms, you know, they don't get screening mammograms, so, discharge from the nipple, mass of the breast. Men's, risk is like 1 in 700.
Then should they do a self-exam?
They're gonna notice it if they have a change in their tissue.
Any questions from the live in person? Y'all are live too. Sorry. In person.
Honestly, that's a good question, and I really don't. Yes. It's called molecular breast imaging. Okay, so when you have dense breast tissue, it's not fatty. So when you look at a mammogram, breast cancer shows up white on a mammogram. Dense breast tissue shows up white on a mammogram. Fatty tissue is like clear, like you can see through it. I wish I had a picture. I should have done that. So when it's very dense, it's like white, kind of spider webby looking. And when you have a breast cancer, it can be easily hidden in that. And so it makes it hard to see.
So it's not something you can like this.
No,
Those things you were like.
yeah, yeah, yeah.
Mhm.
And, a lot of younger women will have dense breast tissue. But I mean, there's nothing really you can do about it. Just,
Is that something then that you should request the molecular breast imaging if you get a letter saying that you have dense?
you know, if they specifically say that you have very dense tissue, yes, you can. And your insurance will be more likely to pay for that versus the MRI.
Okay.
Thank y'all for
Yeah,
coming.
bye, y'all. Okay.
It just depends.
But you have to have that documentation first and then.
Yeah, and
give it to
sometimes, sometimes the radiologist, they feel like they see something, they will
Mhm.
request that, but the best thing they can do is just do a, ultrasound with both breasts.
Mhm.
That's gonna be the best thing, because then if there's a nodule there, they're gonna see it. And if they do additional tests, they can.
Mhm.
Yeah.
Any other questions in person?
You ever heard of caffeine pumps before?
Huh? Yeah. Yeah. The best thing you can do before your mammogram is cut out your caffeine a week before.
A week?
Yeah, I know.
Oh,
Not a week, maybe like.
wow.
2 days. Yeah. A week before the test, 2 days would be okay.
Okay.
Yeah.
I might have to be on
Yeah.
vacation.
Yeah.
You know, like,
It's time for me. Yeah, yeah. Wow.
Yeah, those can be significant in size too, especially for younger.
Mm.
Absolutely.
What about the, I don't know if I'm gonna say this correctly, if I'm gonna remember it right. LCIS cells? Okay,
Lobular carcinoma in situ.
okay. So can you speak on that? Cause it's
Yes.
not actually breast cancer,
Right,
but it has a likelihood.
right. So DCIS and LCIS, so those are both considered like a stage 0 of breast cancer because they are in situ, which means that they are encapsulated with DCIS encapsulated within the duct of the breast, with LCIS within the lobules, so like the sac that I showed you guys. So with both of those, they have the likelihood, if left alone, they could grow and eventually break out and become an invasive breast cancer. Years ago, LCIS though nothing was done with it. It was left alone. Like if you found LCIS, there was nothing else done with it. Like even if you had a positive margin, it was left alone. So, but now it is removed and treated like a breast cancer. So, yeah, I had somebody not long ago that had that several years ago, like 20 years ago, she was treated. And then she had a recurrence
Okay.
and had to be treated.
My sister has that, so, and is being treated, so then that affects my risk factor, that's it.
It does.
My history is higher, okay.
Does.
Yeah.
And lobular carcinoma is more likely to be in the opposite breast as well. So she needs to have both breasts checked.
Yeah, she's on a real regular
Okay, good.
schedule
Good.
and for the cancer center.
Good.
Yeah,
Good.
yeah.
Awesome.
Okay.
You doing right?
I do.
Oh, yeah, so I brought this breast model. And this has all cancerous lumps in it, okay? And I have benign ones in my little baggie in here too. But, so this is a good way to practice doing, breast self exam. And it's got this powder, and all this powder does is just helps you glide over the model a little bit better. So 3 fingers, and you can either do what I call mow the lawn, or you go across it like this, or you can start in the middle and then go in a circular motion all around. But just pointing out some of the obvious rash change in the skin, it's got a texture change right here. And then right here, there's a pimple in the skin. Right there.
Damn.
So we'll pass this around. You guys see if you can find, there's 1, 2, 3, 4 lumps. Don't cheat. Just kind of bring that around on there. So, and it's different levels in it. So, you gotta do the light, medium, deep, be able to fill them all.
Any other questions while we're passing this around? Any questions from the online audience? All right, so as we're passing that around, I know there may be, those that have to get to. Oh dear, sorry if y'all can't see online. Bear with me.
Oh, go ahead.
Right there, okay? And it's gotten bigger, okay? No one has ever said anything to her. Okay? How do you hold off her feet?
So what happened said to her about it? Nothing, she had an image, like have they done ultrasound on it?
They do. Some soldiers, and what sometimes have. So she never really pushed it, like,
How old is your mom?
it's 50 feet.
She had a mammogram. That's gonna be your first question. I think your mom should have a mammogram. I've had women who, yes, I had a woman who, her first symptom was a lump right there. But then once she had imaging of her breast, we ended up finding the primary lesion. But I did have a lady who had a lump in her armpit and we never found the primary breast. So, so it might not even show up on, right. So, yeah, so that's the thing, it's like, that's why you gotta be so self-aware of things like that. And it might not be breast cancer, it could just be a swollen lymph node from, some kind of infection like sinus stuff, all that stuff drains in that area. But it is worth checking out for sure. Absolutely. Tell her to come to Keller. Take care of her.
Yes, they will. Any other questions? All right, so as we're still passing around the model, Whitney, I'm gonna let you do our honors. Just if you'll draw a name, we are giving away the Quick and Healthy 50 Simple Recipes by the American Cancer Society. This is a pretty recent edition. Yeah.
Tiffany Hale.
Tiffany Hale. All right. Yay. And so if you will just
Give that
book to her, I'm over here doing.
All
All
right.
right. Congratulations, Tiffany. There's some really good recipes in there. Yeah. Yeah. We're going to give away one of those at every session for the remainder of this month. So we will next week have another giveaway for that same book by the American Cancer Society. Even though it is a financial wellness session, we're still going to in support of breast cancer awareness. Those are some great recipes that help to reduce your risk. Whitney mentioned nutrition, our diet. So that is one way. Because you're so stressed. Exactly. And then join us again, certainly next week at noon. We will be in the GUC in the, what's that room called? That SGA chamber room. We're going to go to next week, and we have Miss Sarah Evans. And then the following week, we will have another breast cancer awareness Wellness Wednesday session. This one will be in the nursing building, and it will be Dr. Grace Sills, and she's going to take a case study for us from diagnosis to and follow this person all the way through to remission and talk about the things, the new findings on ways to stay in remission, that type of thing. So yeah, so we've got 2 sessions, and then at the end of the month on the 30th, we will have a little fun Halloween party, but we're going to have healthy treats that Dr. Renfro is going to provide for us that we don't have to get all sugared up. We can have some healthy fun. And we're also going to play a breast cancer bingo. And there will be first, second, and third place prizes. So, all right, y'all. Thank you so much for coming. Thank you, Honor. Thank you, Whitney. Always love having you.
If you have any questions or
Yeah.
something comes up, y'all feel free to reach out.
And she also has,
I got nail files.
yes, nail files, notepads. If you didn't get a pen, make sure you get that. And we got those great. Everyone should have received one of these, but if you didn't, grab one on your way out.
Yes.
I'll put these over here at the table. All right, thank y'all. We'll
Thank
see you
you.
next week.
Yeah.
That was very good. Mhm. All right. Let's see. Yeah, congratulations. I hope you enjoy it. Let us know if you try one of those recipes. Okay.
Yeah,
All right.
absolutely.
I sure, because I looked at it yesterday when they came in and I thought I need to get with you.
Yeah, my,
There's some really good.
okay.
Okay.
Thank you very much.
Yeah.
But I was.